Best thing I can say is stroke is a brain attack. We have heart attacks when you have a blood clot or something stops the heart. A brain attack is a vascular accident to the brain. It's also called a CVA, or a cerebrovascular accident. It is a situation in which there's a sudden or a gradual decrease in blood flow to some part of the brain, and the blood flow is either stopped because something blocks it or because a blood vessel ruptures and blood doesn't get to the brain. Another definition of stroke is infarction. If it's in the heart, it's called myocardial infarction. In the brain, it's called cerebral infarction or brain infarction. So basically, a stroke is a CVA or a brain attack. Now, there are essentially two kinds of stroke. Stroke is either a hemorrhagic, meaning bleeding, so there's a bleeding stroke, or there's a ischemic, or lack of oxygen or lack of blood flow stroke. So there's a hemorrhagic stroke and an ischemic stroke. Now, a hemorrhagic stroke occurs when a blood vessel ruptures. It might be a sac or aneurysm in the blood vessel in the brain and ruptures. It often occurs in younger people. It might occur in a car accident or a fight somebody gets into, or a rage, or just might happen spontaneously. But the blood vessel ruptures and bleeds into the brain and causes damage such there's not blood flow, so it's a hemorrhagic stroke. The other kind of stroke is ischemic stroke, and that's when a blood vessel that feeds the brain is blocked, and it can be blocked by a number of ways. For example, one might have an infection and dislodge bacteria or something that will clog the artery, or there might be a arteriosclerotic plaque break off in the heart or some other place, even in the neck, go to the brain and block the heart. Or there might be just constriction, even things like it's possible to have a gunshot or something in a bullet go to the brain. But something from either a foreign body or internally gets into the artery system and gets to the brain and blocks the artery. So that's an ischemic stroke. So what would be a tip-off that one's having a stroke? Is if you're having a sudden blurred vision that's not normal, either in one or both eyes, it's a tip-off that a stroke might be coming. And if that happens, one shouldn't sit around for an hour or two deciding if it ought to do something about it. It should be immediately assumed that it's a brain attack. The second kind of a tip-off is weakness or numbness or paralysis. Maybe suddenly can't move my hand. Or if you had suddenly trouble speaking or understanding somebody who's speaking, it's a tip-off that there's a stroke, particularly if it's never happened before. And it's not something that you can't wait till the next morning because it'll be too late. Well, Core Clinical, where I work, is involved in developing new medications to treat illnesses of man, and specifically medications to prevent stroke. And we are seeking patients to enroll into studies to treat high blood pressure, which is a major risk factor of stroke. We have a number of studies enrolling individuals to treat high cholesterol, which is a major risk factor. We have quite a few studies treating diabetes, both inhaled insulin, various medications taken by mouth, to treat diabetes, which will lead to decreased incidence of stroke and also lead to new medications to treat diabetes. Atrial fibrillation, we're looking at not only at fish oil to see how well it might prevent stroke, but looking at new forms of anticoagulation. All have a direct impact on decreasing risk of stroke.